Hello, everyone. Welcome to another episode of Nadya's Entrepreneurial Corner. I am very excited, as I always am on these podcast episodes, to speak with yet another innovative and pioneering entrepreneur. And right here in the Las Vegas Valley, no less, welcome Ephraim Makuve of Hutano. Thank you for being here.
Well, thank you very much for the kind words. And yeah, we haven't hit triple digits yet in the Valley. That's pretty
Don't jinx
amazing
it.
for what, the 22nd of June, and we haven't hit
Don't
100
jinx
yet.
it. It's so nice outside. It's crazy. Like if we can keep up with this mid to upper 80s situation, at least another couple of weeks, maybe we'll end up having like 2 weeks of triple digits and that's it and call it a day.
I'll live here forever. I'll tell you that much. This is great. I like
If it's always like this, then but the only thing I will say is that means that more of our Californian friends, and I am a California transplant, so I'm one of those, it's going to come flooding because when I was in LA like 2 weeks ago, it was literally 5 days of extreme June gloom. It was so chilly. It was like in the low 50s in the morning, cloud.
So you're saying that the weather was a deterrent from getting a mass exodus of people from California to here, and now that the weather is starting to look good, we might end up having the whole of LA.
Even more, the whole state might come flying over here, but let's not jinx that either. So maybe just a few more degrees hot just to keep that from happening and to keep us satisfied with the.
I love it, Nadya.
But yeah, I mean, we've known each other now, I want to say like a little over a year or so, which is crazy how time flies. And, you and I talk a lot about the Las Vegas business community and the ups and downs of it. And like, it's a very interesting place. Like, I mean, it's not the easiest thing to find other startup founders or other companies in tech that are really excited about innovation and growth. And of course they are there. And of course there is a lot of innovation and growth in Las Vegas, but you just don't really hear it or see it as prominently as perhaps you would in other cities. So, before we get into all of that, what has been your experience and how long have you been here?
Yeah, so I moved here in 2012, I believe. Yeah, I had a short stay in Washington State. Loved it very much. Moved to Vegas in 2012, and I've been here since then. So yeah, I'm coming on to 11 years now.
11 years, wow.
Mm-hmm. I think in Vegas, if you've been here for 2 years, you're a local, so you can just claim it as your home. So.
All right, I'm officially a local now. I mean, of course. Well, you weren't born here, like the real locals, and they're very interesting people, like those who just like grew up, because Vegas has grown so much over the last decade. And of course, if you've been here over a decade, then you've seen it like just grow so quickly, these new developments and new communities. And where I am in the Mountains Edge area, it's super fast growing, which is wild.
Yeah, no, I used to live out there when I first moved here, and there was nothing but dirt and running trails, and now I can't even recognize the place when I go out there. And so you're absolutely right. It's a growing city, and I've seen it diversify from just gaming to what it is now, which is a diverse community where families find a place to live and are able to actually raise families without really being a part of the gaming industry. So it's really been awesome to see that growth away from just gaming. And by the way, the Golden Knights did it, so that's awesome.
They did it. I will admit, I'm the first to admit I'm not a big sports like person, but I have seen people post about like different things going on with the Golden Knights, and like, okay, like that's good. Like
Golden Knights fever, you gotta get in it.
I gotta get in the fever. I might need a couple drinks to do that, but that's not hard to achieve here. So Hutano is a med tech platform. Can you tell us a little bit about like the inception of it? What was the seed of the idea and how are things going?
Yeah, so I would have to go back to where all this started. So I was born in Zimbabwe, as my accent kind of gives it away now and then, more often than I want sometimes. But anyways, I was born in Zimbabwe, and when I was in Zimbabwe, I went to school for computer science. So by the time I came to the US in 1998, oh my gosh, I'm dating myself. Children have been born and are now adults since 1998. Anyways, so I came to the US.
I was 11.
Yeah. I won't say how old I was. Maybe I was 11, but we don't know. I had
So maybe you were
graduated high
just
school.
really a prodigy, like even more of a
Yes,
prodigy than you probably
yes.
already were.
Graduated high school, had a college degree at 11. Let's just leave it at that. Anyways, I came to the U.S. Having a really unique skills in at the time I was a systems engineer, so I used to put computer networks together. That really was my passion. By the time I moved here, the place I called home was North Dakota. And while I was in North Dakota, I really expanded my IT career to include everything, including software engineering, building websites, graphic design. And the last 7 years of my career in IT, I worked in the gaming industry. Strange enough, I ended up in Vegas. But anyways, this was a casino in North Dakota, and I was the uh, director for the IT department for 7 years. But anyways, I say this because the backstory behind me ending up in IT was I always wanted to be a dentist. And the person that spoiled it was the person I followed for like a week. And he says to me, "Do you really want to look up people's mouths for the rest of your life?" And I don't know why he said that, but all of a sudden it was like, no, I don't want to be a
You're like,
dentist.
oh, that sounds a little more like, I don't know,
No,
involved.
I probably don't want to do that. No. Anyways, in 2007, I really was kind of starting to run into a fatigue period of being in IT for such a long time. And so I decided to go back to healthcare, which was, where my roots were. And the first option was medical school. So I started doing pre-med school studies until I kind of decided that just wasn't what I wanted for my
Right.
family, and then ran into physical therapy. So it's while I was a physical therapist that it was blatantly obvious. I mean, I walked in the industry, I started using the software, and I said, "Come on, there's something wrong here." As a systems engineer, something is not quite right. But it took me about another 5 or 6 years to really start doing something about it,
Right.
and that's
What
when
was
Hutano
that that
really.
wasn't right? Like, what was like the most glaring problem for you?
Yeah, so the most glaring problem for me was the way the software was written actually seemed to increase the workload for us clinicians and seemed to have no value for the patient whatsoever. So, in other words, the patient could not interact with the software, right? And for the provider, it was just more work. And so, my question was, what good is it if it doesn't serve
Was it like a
me and it doesn't serve the
fancy,
patient?
fancy data entry platform? It sounds like.
Yeah, and one would have to appreciate the roots of the electronic medical record software as it stood at the time. It was really designed to meet this need that President Clinton back in 1996 made a mandate that we need to secure records, and we need to make sure that only the people who should have any interest in a medical record have that access. So we created this database-driven pieces of software that were designed to do nothing but store medical records, not necessarily user friendliness or interact with patients, but you fast forward to 2010, 2012, when I was starting to conceive some of these ideas. We were starting to see a lot of applications that were interfacing with patients and actually adding value to the patient journey. So
Yeah.
wasn't designed for it, and this is what we ended up with.
Gotcha. So, okay, so you're like in that, like kind of figuring things out, but how did this lead specifically to like Hutano, and like what is Hutano?
Yeah, so Hutano defined is uh, a platform that addresses the 5 components that are required to access primary healthcare. So we focus on primary healthcare because primary healthcare is the gateway for a healthy population. So you look at it this way: if people cannot see their primary care healthcare providers, they let things that would otherwise be benign, or maybe things that would be manageable, become big problems that land them in the hospital, where they end up with a big one, right? It's the heart attack, the diabetes that's uncontrolled, and a whole lot of bad things start happening. So the 5 things that we address are finding a healthcare provider, which may seem like that's not a big deal, but it is really hard. Go to a new town and try to find a healthcare provider. It's really tough. Once you found a healthcare provider, what do you want to do is you want to book an appointment. Now, there's all kinds of friction for patients to book an appointment. So we kind of make that as easy as we possibly can. And then the third step is filling out paperwork. Now, this is for anybody who's ever been to a doctor's office. literally you're writing your name and your date of birth like 7 or 8 times, because every piece of paper is asking for the same information. It's redundant
Right.
information. And then by the time the doctor and their staff put it into their computer, the chances for error are so high. And then, of course, not to mention, the patient never gets to see what was put in the computer about them. But anyways, that's another topic for another day. And then the fourth part is the documentation. How do we get all this information that the patient has put it into our system and transfer it in the patient's own words into the provider's documentation, so that we save the provider all that repetitive talking about something that a patient has already said? And then the
Right.
last thing, which is as important as everything else, is follow-up appointments. So managing follow-up in such a way that there is no friction at all. So if the patient is coming to see me, I can just set up the appointment for them
Right.
on the platform, and they get a notification on their phone, and life goes on.